I will talk about two abstracts from the group of francophone des myelodysplasie. So the first one is EPO-Pretar trial, where the background is that ESA has authorization for MDS patients with anemia in Europe. But the time for introduction of ESA, early or late onset, is not really known. And in a retrospective study, we have shown that the time to red blood cell transfusion dependence is longer in patients who had early onset of ESA within 6 months from diagnosis. So in this, the trial we presented at ASH this year, we evaluated prospectively the early or late onset of ESA on the time to red blood cell transfusion dependence. So therefore, we included the patients, lower risk MDS patients with hemoglobin between 9 to 10.5 gram per deciliter in the early arm, and in the late arm, the patients had ESA whenever hemoglobin reached 8 to 9 gram per deciliter. So there were 43 patients in the early arm, 41 patients in the late arm, and they were well balanced in terms of gender, IPSS, R score, and WHO classifications. And the primary endpoint was the time to red blood cell transfusion dependence, and it was the same between both arms, with a median time to red blood cell transfusions of 36 months. Nevertheless, for the secondary endpoint, we evaluated the erythroid response and duration of response to ESA, and the erythroid response was higher in the early arm, with a 79% of response rate in the early arm versus 54% in the late arm. And the duration of response was longer in the early arm, 30 months versus 12 months in the late arm. These results did not translate in quality of life scores. The quality of life was the same in both arms. And for longer outcome, PFS and overall survival, they were the same in both arms. In biological correlative studies, we have evaluated the IPSS-M score, and in the responders, they had a lower IPSS-M score. In terms of red blood cell transfusion dependence time, it was shorter in patients with a high IPSS-M score. And finally, we have done RNA-seq and cytokine profile dosing, and we have shown interestingly by RNA-seq that there was a erythroid signature which predicted the patients who will become red blood cell transfusion dependent, and the responders to ESA had a lower IL-6 cytokine dosage. So finally, this abstract demonstrates at the data cutoff of July 2024, where half of the patients had ESA in the late arm, that the red blood cell transfusion dependence was same in early or late onset arm of ESA, with the same outcomes, with same quality of life, and with interesting biological markers predicting time transfusion dependence.